Good afternoon, everyone, and welcome to our Facebook Live session on pancreatic cancer in observance of Pancreatic Cancer Awareness Month. My name is Michael, manager at Baptist Health for our community wellness centers located within the YMCA's, JCA, and Baptist Health Places around Jacksonville. And I will be your moderator this afternoon. So I invite everyone to tune in for the entire session if you can. There's going to be a lot of great information that we're going to be discussing today and welcome you all to join in on that conversation. So drop a comment in. Let us know that you're here and watching with us. If you have any questions, I'll be monitoring those along the way and can relay those over to our guest speaker today, who, without further ado, like to all meet Dr. Niraj Gusani, physician with our Baptist MD Anderson Cancer Center. Dr. Gusani, thank you so much for being here today.
Thank you, Michael. It's a great pleasure to be here today. Um, I'm delighted to talk about this very important topic, something that I think is understood in the general public, if you will.
Yeah, and Dr. Sani, before we jump into our topic, would you like to tell our viewers a little bit more about yourself?
Yeah, absolutely. So I'm a surgical oncologist. That means I've done training in general surgery, followed by a special training program to take care of patients with cancer or precancerous or non-cancerous problems, mostly of the upper GI tract. So the organs like the stomach, the small intestines, the liver, the pancreas, the bile ducts. I take care of other things as well, and we have a team of cancer specialist surgeons here at Baptist MD Anderson to sort of take care of people with all different types of cancers. And we focus, as I said, my team on the upper GI tract. And we'll be talking about the pancreas today. That's one of my kind of favorite topics. I am new to Jacksonville. I just moved down here relatively. Recently in the last year to join the program at Baptist MD Anderson and to try to help expand that. And I'm excited to be part of the team here. Um, I'm originally from up north, and so enjoying the warmth during the winter here.
Well, we're so glad to have you here in Jacksonville with us and joining that Baptist MD Anderson cancer team to really bring your knowledge and that team approach to the services and the treatments that we have available here to us. And as you mentioned, we're going to be discussing pancreatic cancer today, and a lot of very important information that is good for our community to know more about. I mean, November being Pancreatic Cancer Awareness Month, it's really important with every health observance month to really get in and understand the health focus. What are the local resources? What are the treatments available? And broaden our horizons with that information. So as we jump into that, could you share more on what we should know about pancreatic cancer, understanding that it's a poorly understood and rather aggressive disease process, and we're glad to give it the spotlight today as we go into it. Dr. Ghasani, where would you like to start off with pancreatic cancer as a whole?
Well, first of all, I wanted to thank you. We're both wearing purple today, and that's because purple is kind of our color for Pancreatic Cancer Awareness Month and for pancreatic cancer advocacy. I think with anything, it's important to have a visual cue to remind us about these types of cancers. So the pancreas is a organ in the back of the abdomen. It's long and thin, and some people think it looks like a fish. And so people name the parts of the pancreas for the parts of the fish. And it really starts right in the center and goes back into the left. There's a head, a body, and a tail. The pancreas has two major functions. First, it produces insulin and other hormones that go straight into your blood and help you with sugar control and some digestive control. The second is that the pancreas can produces enzymes that help us to digest fatty foods. And these flow through the pancreas through a series of ducts and glands, and then flow into the intestines when we eat a fatty meal to help us with our digestion. And both aspects of the pancreas, both types of cells, could theoretically go bad and cause pancreatic cancer. The more common type, though, is the one that comes from the duct and the gland cells. So this is called pancreatic ductal adenocarcinoma. It's a cancer, like I said, of the gland cells of the pancreas, and it's one of the more common cancers, and unfortunately, one of the more deadly cancers.
And so, with that being the most common type of cancer, how does that typically manifest for patients? How do they know that they're experiencing this? Are there symptoms to be aware of, or screenings that can be done to recognize that?
Yeah, that's a great question and critically important. Before I get to that, let me give you a few statistics. So, about 60,000 Americans will be diagnosed with pancreatic cancer every year. So it's quite a
Wow.
common cancer. It is in the top 10 of all cancers that are diagnosed, closer to the bottom of that list. But unfortunately, pancreatic cancer is the third leading cancer killer among the United States population. And that means that we have relatively poorer outcomes in pancreatic cancer compared to a lot of other cancers. If you think breast cancer and colon cancer and so on, our survival outcomes are much, much better. Unfortunately, pancreatic cancer is on the rise, and by 2030, it'll be the second most common cancer killer in the United States. And that's because in other cancers, we're making faster progress in terms of our ability to find and treat the cancer. Most patients with pancreatic cancer present late, and so that's one of the issues is that by the time we find the cancer, often it has already spread outside the pancreas. Typical symptoms you do see, and why it's important to kind of listen to your body, can be pains in the abdomen, especially going into the back, underneath sort of where the ribs meet in the middle. You can develop difficulties with eating, feeling bloated, feeling full fast, sometimes gas pains, and sometimes that progresses to nausea and vomiting. People can develop weight loss, which can be a sign. And so, try as they might, they're eating normally, but they're losing weight, and that's unintentional. People can develop jaundice. So, jaundice is a yellowing of the eyes, can be seen on the skin as well. The pigment from bile, which is blocked in this scenario, turns yellow in the blood, and so you get this yellowing of the eyes and the skin can be noticed under the nails and under the tongue as well. The secondary signs of that are that the urine can become dark. We call it tea-colored sort of urine, and the stools can actually become light because when bile is not in the stools, they become clay colored or sort of gray colored, and so those can be some common signs of pancreatic cancer. Uh, and something that certainly should merit attention. As you can imagine, a lot of these are very common, and so other
Right.
diseases can mimic the signs of pancreatic cancer, and people can have non-cancerous things that cause these as well.
Those are some staggering statistics, and you're quite right. The symptoms that you were sharing seem to be commonly experienced and can be part of other disease processes. And you mentioned that the symptoms don't tend to arise until later on in the pancreatic cancer development. Is it at a certain stage that one would start experiencing these symptoms, or is it something that it could be found early on enough for treatment?
Yeah, so the reason for this is that the pancreas lies in the back of the abdomen. It's surrounded by a lot of other organs, and really a mass would have to get quite large in the pancreas before it would cause local compressive symptoms or problems. And so often these things will spread into the blood and be more advanced. The times people get the jaundice that I talked about is because a duct from the liver that carries the bile goes through the pancreas and can get commonly blocked. But I think the way to think about it is that if something's not doesn't feel right, go to your doctor. They may start with a simple exam and talking to you. You may get other tests like ultrasounds and endoscopies and so on. Eventually, when there's enough concern, things progress to some sort of what we call cross-sectional imaging, a CT scan or an MRI, and that's often the way we diagnose um, pancreatic cancers is by seeing either a mass itself or some secondary signs on these imaging studies. You asked about screening and is there a way to find these things early?
Yes.
You know, Unfortunately, there's no a perfect screening test. Because it's a relatively rare cancer, screening the whole population would result in too many false positives, and we wouldn't really get a good answer. So there's no established, and we don't have the right blood tests or other way to screen. However, there are some things that we're working on to figure out groups of populations where the risk of pancreatic cancer is higher and where we might find these things early. So there are three of those I want to talk about. First of all, if you have a strong family history of pancreatic cancer, there are some genetic syndromes that can predispose to this, and you should have a discussion with your family doctor, primary care provider, and some people end up getting genetic tests because of their family history. Those with the genetic predisposition would qualify for screening with MRIs and something called endoscopic ultrasound to look for early signs of pancreatic cancer. And then there are two groups that I talk about, or that I think about having a higher risk potentially of developing pancreatic cancer. One is those with pancreatic cysts. So cysts are fluid-filled pockets within the pancreas. We'll find them on a CT scan or an MRI. They're often of no consequence, meaning they're benign and not cancerous, but some cysts of the pancreas can be precancerous sometimes, or even cancerous when we find them. So the finding of a cyst in the pancreas often prompts a person to see their GI doctor or a surgeon like me, and we can do tests to figure out if that cyst is worrisome. So a cyst should make us think about whether that could be precancerous. Often it's not, but it can be. And then finally, if you have new onset or worsening diabetes and you're a little bit older, so all of us are at risk for type 2 diabetes,
Right.
resistance to insulin as we get older. But if you have a rapid onset of diabetes, really significant change in the sugars, if you're older, if you've also lost weight, that constellation of symptoms is actually potentially pancreatic cancer, not in everybody, but should prompt some thought about whether pancreatic cancer could be the cause of this.
You had mentioned genetic disposition earlier in family history, and is that is it recommended to get either genetic testing or have this conversation with your primary care doctor if there's a family history of just pancreatic cancer, or would you consider that's an important conversation to have if there's other GI cancer history, or even breast cancer or other cancer developments in the past?
Yeah, so thank you for pointing that out. It's actually not just pancreatic cancer, other GI cancers, as well as breast cancer, because the same gene that causes some forms of hereditary breast cancer, the BRCA gene mutations, can also increase your risk of pancreatic cancer. And so those patients might qualify for a screening program. We actually have different forms of treatment for some patients with BRCA associated pancreatic cancers. And so, really, any family history of cancer should prompt a discussion. And then, in looking at that family history a little closely, we can decide whether you need testing. Any testing that is done should be with the help of a genetic counselor, because interpreting the test is hard for anyone, even those of us who are doing it every day.
Right, I can only imagine the interpretation there. With, Dr. Gasani, with pancreatic cancer in general, the treatment options, is that the same across the board? You mentioned that there's several different types of, pancreatic cancer, the adenocarcinoma being the most common, but, is the treatment approach typically the same, or does that vary based on the type of cancer, that's presented?
Yeah, that's really important. There are different types of cancer. So if you think about famous people who have had pancreatic cancer, Alex Trebek and Patrick Swayze and Luciano Pavarotti and Ruth Bader Ginsburg, they all had the gland or duct type of cancer. Steve Jobs, on the other hand, had the neuroendocrine tumor, the type of cancer that occurs from the hormone cells of the pancreas. The treatments are very different. A lot of the diagnostic workup can be similar, meaning you find these things with ultrasounds or CTs and so on. Once you have the diagnosis, the treatments vary a lot, and so it's important to go to a specialist who can help sort these things out. When we think about the more common type of cancer, the gland or duct cancer, adenocarcinoma, the treatment depends on how advanced the cancer is. So if the cancer,
Okay.
and at every stage we have treatment options and
Mm.
increasing sort of options available, better tests, better drugs, better treatments in all aspects. If the cancer is advanced, meaning it has spread outside of the pancreas to other organs, usually the treatment is chemotherapy. So we're talking
Mm.
about one or a combination of chemotherapy drugs, and those are improving, and we have new regimens now, but usually that's the mainstay of treatment. If the tumor is localized to the pancreas or the area of the back of the abdomen, we'll often still start with chemotherapy with the goal of shrinking a tumor, getting it to a point where it's localized or a little bit more manageable. But then we often want to do surgery and or radiation to try to remove that tumor and to get rid of the cancer. And so for localized pancreatic cancer, there is an array of treatment options and potentially curative options as well. So it's really important to be evaluated by a place where all those options are available.
That is encouraging that is an option if it's caught early enough. And with obviously with technology and advancements, are there any new advancements on the rise that you're aware of for either the detection or the treatment of pancreatic cancer that can improve the prognosis once diagnosed?
Yeah, so early detection is still the holy grail of pancreatic cancer and trying to get
Sure.
there. There's work to do, but we're working on blood markers and ways to look at tumor DNA and in the blood and so on to try to figure these things out early. Um, the treatment options are improving vastly. And so, just compared to a decade ago, surgery is safer and done less invasively. Radiation is done with very focused radiation beams with minimal side effects to other organs. Chemotherapy regimens have proliferated, and we have more drugs and more options for different types of cancers. And for the first time, now we're getting to molecular based treatments so we can target the genetic mutations in each person's cancer with certain types of treatment drug combinations. And so we can have more of a personalized therapy for patients with different types of cancer, and we're getting there in pancreatic cancer as well.
That's great. That's great that there's always new and improving modalities on the rise that are becoming available. It, there's a myth that as I was reading on pancreatic cancer and just educating myself prior to our conversation today, there was a myth that I saw that people were asking, "Will surgery make my cancer spread? Will that make the tumor spread to other areas of the body if it is localized at the point?"
Yeah, it's it is a myth, and we'll talk about why in a second. There's no doubt that pancreatic cancer is an aggressive cancer, and
Mm.
unfortunately, many of the patients I see to talk about surgery are not candidates, certainly at the beginning, for pancreatic cancer surgery. But there's also a lot of negativity and nihilism out there. People are think that any treatment for pancreatic cancer is worse than the disease, and so a lot of people patients don't get sent to a surgeon or to an oncologist to talk about what options there are out there. And so I think that's something we have to fight against. Get people at least seen and evaluated, and often we'll find treatment options. Again, as we talked about, we can shrink tumors and make them amenable to surgery when they often weren't in the beginning. Surgery itself is designed to remove the tumor in its entirety and try to keep it from coming back. A lot of times, though, when we get in there, we will find that the tumor has already spread. And people say, oh, well, the air hit the tumor and it spread. No, that's not the case. It's just that the small volume of disease that has spread is not detectable on CT scans or MRIs, but we can see it with our eyes or with our cameras when we're in the abdomen to do pancreatic cancer surgery. The other thing that can happen is that somebody already has microscopic disease in the belly cavity or in the blood that we can't detect with our best studies, and we go ahead and do an operation to try to remove a tumor. A few months later, the tumor recurs. That probably means that we weren't good enough at detecting it to begin with, and it was already there and unfortunately grew. So we try to avoid surgery in patients like that because we're giving them risk without benefit. We are getting better at figuring out who those people are, but unfortunately, sometimes the tumor evades our ability to figure it out, and it looks to have spread at the time of surgery or right afterwards.
Wow. So, uh, we did talk a little bit about, and thank you for clearing that myth up. And we talked a little bit about the treatment, and you mentioned the many symptoms. Uh, could you speak a little bit to the risk factors that can involve other? We mentioned genetics and family history of cancer, but what other risk factors should the community be aware of and keep in forefront of their minds as they're trying to prevent this?
Yeah, so as we discussed, new onset diabetes, with weight loss in an older patient, pancreatic cysts that are changing or growing or causing symptoms, those are definitely risk factors for pancreatic cancer. The other common risk factors, aging. So this is a cancer with an average age of onset in the mid 70s, and so as we get older, we're all at risk for every type of cancer, but pancreatic cancer is certainly one of those with the biggest age relationship. Obesity and smoking are somewhat modifiable risk factors. It's not easy to quit smoking. It's not easy for any of us to lose weight, but that is an important thing that is modifiable. And we know are some very common risk factors for pancreatic cancer. So all of us can work, to stop smoking, stop using tobacco products, and to optimize our weight for all aspects of our health, but can decrease pancreatic cancer risk as well.
And so it is very important just taking on is initially just any healthy lifestyle that you can from where you are currently to move in that direction to prevent either this or any other cancer development. That's
Yeah, people always ask, "Oh, what diet should I eat?" I want to prevent cancer. That's a big concern of mine. And someday we may come up with the magic anti-cancer diet. Right now, it's still a healthy, balanced diet with optimizing protein, minimizing fat, all things in moderation. Everything your grandmother told you when you were younger. Alcohol is something that there's conflicting data on, but overall alcohol in large amounts probably predisposes to certain types of cancers, and so certainly in moderation makes sense to be careful. As we get into the holidays, all of us want to overindulge, and I think in small amounts of time and small quantities, that's probably okay because we need to have joy in our lives, and food and all of these things give us joy. We just have to be careful overall that we keep it in moderation and we try to follow the principles of diet and exercise to have a healthy, balanced life.
That's great. And leaning on your medical professionals and that care team, whether it be whoever that might be, to assist in that process as well, and moving your health in the right direction. Those are some great tips, Dr. Gasani. And I feel that we've done a really a really quick, a good rapid overview of pancreatic cancer and treatment and symptoms. But are there any other major points that you would like for our viewers or just the community to know when it comes down to pancreatic cancer?
Yeah, I think the message is one of hope. This is a tough cancer. Pancreatic cancer has among the worst survival of all kind of solid tumor cancers in the country, and we need more people aware of it, more people doing research into it to improve our outcomes. But we are making great progress. This is a time where we have new treatment options almost every few months, for different types of cancers and including pancreatic cancer. As I said, our surgery and radiation chemotherapy are all getting better and safer and less invasive. So there is hope. And at every stage of cancer, there are going to be treatment options. And so I want to dispel sort of this myth that pancreatic cancer is such a negative cancer that there's no hope. The other thing to remember is that we want people to listen to their bodies. It's hard because a lot of the signs and symptoms are very common and really can represent a lot of different diseases. But if there's something
Mm.
persistently wrong with your body and it doesn't feel right, ask your doctors to look into it, and that can be helpful. The last thing is this, that there are a lot of studies out there that show that aggressive cancers like pancreatic cancer are best treated with a team approach. And so find a place that has a team to take care of all aspects of the cancer, whether you need a diagnosis, whether you need better imaging, whether you need chemotherapy, radiation, or surgery, immunotherapy, or something else. All of that can be done together. And in addition to that, you need nutrition, other supportive care. We often involve our palliative care colleagues very much up front for symptom management. And palliative care sounds very negative. It sounds like you're end of life, but we're trying to turn that around. Palliative care should be available to every cancer patient at every stage because our palliative care physician and other experts are very good at managing symptoms, helping to make quality of life better for anybody with cancer. So I think it's important to think about those options and get the help you need from a center where all of these things are available.
Wow, and I love that you did bring that back around because just as you shared at the beginning that you have a whole team with you over at the Baptist MD Anderson Cancer Center to assist with this approach, and it doesn't just stop there. The importance of uh, the support team or the support that you have from family, from friends outside of that care team, I'm sure really does assist with the symptoms and the quality of life and improvement.
Yeah, and if you're faced with a difficult diagnosis and you're trying to work through these options, whenever possible, it is important, as you suggested, to bring a care team. To have significant others or family members or whoever can support you. Trusted friends and colleagues and so on, because sometimes 4 ears are better than two, and you can miss things. People are
Mhm.
tend to be very flabbergasted and upset when they hear the C word, that they have a cancer. Um, so then they miss everything else that's part of the conversation. And so it's important to bring people with you, to take notes, to record the conversation, do whatever you need to do so that you understand, because anxiety often comes from not understanding. And so helping you understand is the job of the providers and physicians, but you can help yourself with being proactive about your care team.
That's wonderful. So just as a recap, and thank you, Dr. Gasani, is so if there's any unexplained symptoms or feelings that you may be experiencing, always bring it to your primary care doctor. Don't let that go by the wayside, and definitely get it looked at. And if any of our viewers is in need of a cancer specialist or looking for to get connected with the care team that we have at Baptist MD Anderson, please do call us at 904 202 7300 or visit us at baptistmdanderson.com. Dr. Gasani, I can't thank you enough for your time today and bringing this education to the community on pancreatic cancer. And for our viewers, it's not too late. Go put on something purple and show your support to for pancreatic cancer awareness as we round out the end of November. And thank you so much to our viewers for joining us today. If you have any continued questions, please post them in the comments. We will continue to monitor those, but also reach out to your primary care doctor to have that conversation. So, on behalf of Baptist Health, Dr. Kasani, myself, I wish you all a happy Thanksgiving and please be well and take care.
Yeah, thank you, Michael. It's been a great pleasure. Happy holidays to everybody, and wishing you good health.
Thank you.